Hello, everyone. Thank you so much for joining us today. I am Samantha, Board Director of Programs and Impact here at WomenHeart, and I'm very excited to be spending the next 20 or so minutes with two of our wonderful champions who are here joining us today to share more about their experience, why they decided to become champions, what attending the training was like, as well as what they now do as champions. As a reminder, Women Heart works very closely with our Women Heart Champions. These are all women living with heart disease who have decided to dedicate their time and leverage their experience to become educators in their communities, peer supporters, and to also provide advocacy to advocate for women living with heart disease and at risk. Women Heart does host the training through which we prepare champions twice a year. We do that in the spring virtually, and we also do it in person in the fall. And so right now it is actually application recruitment season where we are recruiting women who are interested in joining us for the symposium. We call it the WomenHeart Science and Leadership Symposium, or SNL. And so we are recruiting women who are interested in that right now, and we'll be doing that again in the spring. So that is part of the reason why we wanted to have this conversation. So anyone who's curious, who's interested, can hear more about the experience, what they can expect, and why they should apply or should consider the program. One of the things that I love about our champions joining us today, and I think we'll be planning to have another conversation so we can also provide more perspectives next week. But one of the things that I love is that you've both had slightly different experiences, attended different trainings, right? And so I think it's interesting to hear from women who have been trained at different times and decided to join the program for different reasons. So without further ado, I'll go ahead and let you both introduce yourselves, Barb and Robin. If you could share your name, where you're joining us from, and then a little bit about your heart health journey.
Well, I'll go ahead and start. I'm Barb Bonchek. I'm from Bloomington, Indiana. And my heart journey started in about 2010 when I started getting symptomatic. And it took about 4 years to be diagnosed with hypertrophic cardiomyopathy. I'm from a small town, so it's small town doctors. And, it's sort of, like my doctor said, he diagnosed it. He said, he was getting ready to retire. And he said, I've only seen this 4 times in my life. So it was sort of a new thing. And so anyway, and he followed me for years, a number of years, keep saying, oh, don't worry about it. It's going to be nothing. Nothing's ever going to happen. Well, I went to Mayo Clinic for a consultation in 2019 and I think it was in the springtime. Then I realized that because my family is and friends in Cleveland, it'd be more simple to go there. And I ended up going there and went there in November of 19 for a consultation. The guy said, when I went to Mayo, they said, come back in 5 years. You're stable. I went to Cleveland Clinic and they go, okay, this is what's going on. Come back in 6 months. Well, I went downhill immediately. And in February of 2020, at the end of February, I had open heart surgery, a septal myectomy. So what I really learned from this is how quickly things can change. You think you're okay, you think things are stable, but you gotta be on top of it because it could literally change in a heartbeat and you have to be prepared. And it was because of myself advocating for myself is I got the proper care. So that's it in a nutshell. And I'm really very pleased to be a part of the Women Heart program, to be able to support the women.
I think you highlight how it's a journey, right? It really is a whole journey. Yeah. Robin?
Hi, my name is Robin Peacock, and I live just south of Los Angeles. My heart journey, I'm adopted, so I didn't know medical history, but I was born with a congenital heart defect, the bicuspid aortic valve, and we discovered it when I was 42. I also had the ascending aortic aneurysm, and so I was on a 15-year watch and wait until they needed to be replaced. So, excuse me, I had open heart surgery in 2022, and I've had an excellent recovery, and I am so thrilled to have found all of these heart sisters to kind of walk this journey with, because just because I'm quote fixed. I still have heart disease. And so to have these ladies walk through and have Women Heart provide this for me is such a gift. So
Thank you, Robin. All right, so I'll get us started with the rest of our questions. I think that, your answers sort of allude to this already, but what made you decide to apply to become a Women Heart Champion and to attend the training? Whoever wants to go first.
Well, I've been participating in the HCM Champion program through the Cytokinetics company, which is the company that produces the drug Mycorrhiza, which is the latest a drug that targeting obstructive hypertrophic cardiomyopathy. And I got involved with them. It just sounded like it was an interesting thing. It's a drug company wanting input, and we meet monthly, and they use all the information internally to help their employees and the people making these drugs to bring it down home a little bit, make it more personal. And so we meet monthly. As a matter of fact, I'm missing a meeting right now because of this, but that's okay. But anyway, I learned about the program through them. They were the ones that told us about this opportunity. So I was thrilled to learn about it. And when I started realizing about the lack of resources in our own in our community where I live, I thought this might be a way to really give back to the community and really help, since I'm a small town, provide a network for people in a rural small town area to have more national access to information and resources.
It's an excellent reason. And I'm glad that you
shout
out to those who help us promote the program, right? And reach maybe people who wouldn't hear about Women Heart or the Women Heart Champion program otherwise. Robin.
Oh my gosh, that's amazing. So I woke up at 3 a.m. 6 months after my open heart surgery with an epiphany of, oh my God, I need to help other people that are facing heart disease, because I was on a 15-year watch and wait, and I didn't really know anybody, any females really. And all we knew about heart disease was men had heart attacks, and I didn't really know how it affected women. And so after I went through my experience, I realized I need to get out there and help people understand the risks of women and heart disease, as well as providing support. And so I started searching on the internet, opportunities to volunteer, and Women Heart popped up, and it just looked like spot on, like women, heart disease, people who want to give back. So I applied, and I'm so grateful, super excited. I woke up at 3 a.m. one day.
Yeah, no, we're grateful that you're both here. So honestly, I'm also grateful for the 3 a.m. thought. So, each of you have experienced the champion program a little differently at different times. What was that training experience like for you? And if you want to share when you went through the program as well.
Well,
oh yeah, you go first. Okay. You go.
I did the virtual training this past spring, and what stood out most for me was the high quality of the training. I was so impressed. The Mayo Clinic doctors and John, who did the storytelling, which really was it was a storytelling activity that really helped you organize in your mind what you want to say in the shortest period of time. And I thought that was very helpful, but and it was informative, and it got right down to the point of how women can help women and the different ways that women can help, women, whether it's in person, virtual support groups, in-person support groups, or whatever. So it really gave the knowledge that the opportunities to be involved are very diverse, and you could basically take your skills and pick out what you want to do, depending on where you're comfortable. Nobody's pushing you in any direction. So I think it's a very diverse, very fine way to reach out to people.
I love that you're saying that, Barb, because when we do the interviews, you apply and then you go through the application process and you interview with some of the staff. We always talk about how it's like a menu of opportunities and how you sort of choose to engage so that you can really leverage the things that your strengths, and also, right, like hopefully safely explore the things that maybe you haven't tried but you want to try. But there isn't a, you don't have to fit in this box of like, oh, as a champion you have to do this one thing. No, people really do have options in the ways in which they engage and how they want to support the community. So thank you for that, Robin.
I agree with everything you said, Barb. I also did virtual. I did virtual 2023, and then I had the opportunity to go to Mayo Clinic in fall of 2025 or 2024, one of those two, and do it in person. And the value of doing both is that you get to meet a lot of the people that you see, those great doctors that are teaching you during the training. You then meet them in person at the Mayo Clinic. And what I enjoyed about the training, both sessions, the camaraderie that you develop with your fellow champions, and when you're going through it together and you're sharing stories and you're developing community, you're developing this bond that is healing. We're all still healing from our events, and it's a continual process to navigate what we're going through, and to have people walking alongside of you that get it is so important. And I think that's one of the values of the Women Heart program. The opportunities are so varied. And what I appreciate is that the champions like to share what we're doing in different cities and different ideas. And so if you have an idea, someone might have already done it. And if you put it out there, hopefully someone replies and helps you figure it out. Mm-hmm. I'm a firm believer of people being put in the right slot based on their tools. And WomenHeart has really encouraged me to use my voice. And so now I'm super passionate about the cumulative patient voice and spreading our experience. So I'm so happy.
Those are great points, Robin. I think something else we should share is, and you all have said this, right? There's community. There's community not only in that you find the support in your heart sisters or the other WomenHeart champions, but there's also community in terms of the collective impact, right? Of all of your stories, of all of the different experiences that we're leveraging as we go out there and we do the advocacy and we do the peer support and the education. So those are really good points. And I also wanted to sort of, use the point that you made to clarify that anyone who attends the virtual symposium is also able to attend the in-person symposium, because we do want people to have that experience. We want you to, if virtually is what works best, we want you to engage virtually. But if you ever want to have the experience of being in the room with all of those other women who are going through the training and getting to know some of the doctors in person, we also want to make sure that's an option. So they're both ways in which people can come through the training and become champions.
And thank you so much for that, Sarah, or Sam. I'm so sorry. The S's. Because it was. I mean, it's such a different experience. And I really appreciate that WomenHeart provided that opportunity. And I highly encourage people to do both.
Mm-hmm. Yeah, me too. So now that you're at different stages. I mean, Barb, you just went through the training this spring. Robin, it's been a few years. After completing the training, what are some of the things that you're choosing to do as a WomenHeart champion? And what are some ways in which you've either used or are planning to use your champion training?
Well, I'm very interested in doing more one-on-one things, like in being involved with the Sister Match program or hospital visits. I had a wonderful visit at our local hospital with the cardiology nurse that's in charge of all the cardiac patients in the hospital. She was so thrilled about this. And, and it really made me realize that might be a way to really get jump started, is working one-on-one. And one thing is, when I attended recently, I think last month, it was like there's the monthly support networks for champions. Mm-hmm. And one of the champions, who is very experienced, said it took her 2 years to figure out exactly where she fit in and what to do. And that helped me out so much, because I don't want to be in a rush. I want to be methodical, and I think that that's very important to know that, especially as a new champion, to keep it simple at the beginning and really let it evolve, and one of the things too I'm very interested in pursuing with heart, women with heart stuff is how to deal with multiple health issues.
Mhm.
I was personally diagnosed with breast cancer a year ago, and I found out there were conflicting things that happened that conflicted my treatment. I had a tachycardia attack the week before my surgery, so they had, my EP guy called my heart surgeon, said she can't do it. It really stunned me a little bit about when you navigate two major health things at a time, how confusing that could be. And that's something I would also like to focus with people, because I think I'm 76 years old. People my age, you have multiple health issues that you're dealing with. So I think with heart and other issues, but I'm just getting my feet wet, and I'm going to keep it simple for a while and just focus on one-on-one work.
Absolutely. I love that you just made that point also, because I think it highlights how each champion brings their own experiences based on the things they've gone through and identifies, right, where there's room to do more. And I think the point you just made of like, oh, I want to work with more women who are going through many different conditions and having to sort of like manage these different things. And what can I do there? Yes, start slow so that you can sort of get comfortable and settled,
Yeah,
right?
right.
But there's always like ideas and things that there's still a need for, and definitely like gaps. And so I really appreciate that in working with so many champions who bring their own perspective and their own experience.
I
Robin?
just think that, the world is our oyster, right? And I love that you want to focus on, the co-illnesses or the co-challenges of health, because that is a problem, as we age. And for me, oh, and the other piece I loved was, yes, start slow. So I came out of the first virtual ready and gung ho, and I was going to move the world and change the world, and I was going to develop support systems all over Los Angeles. And because that's just my personality. And I realize what I set myself up for sadness and for, so I think that hearing the advice of come out of it, take a minute, assess what you've learned, look at what you like to do, look at what you're good at doing, and really kind of take the first few months to kind of decide, unless you already go into it knowing I'm going to start a nonprofit, I'm going to start a support group, I'm already involved with my local hospital. I think you need to kind of sit back and then just kind of start exploring different opportunities that are of interest to you. And of course, the different opportunities that come across the Champion portal. I have evolved over the 3 years during my Champion journey, and my passion is getting the patient voice to research advisory panels and participating in advising studies. Like what you told me that you do with the HCM is amazing, because that's the room that I'm in these days, is trying to get voices like yours to companies and to research studies, because we are a partner in this, and we do bring our experience, which is super important. So I do a lot of one-on-one, and people in the community know that I have this heart issue. And so people reach out and ask me to speak with a neighbor or a friend. So it's like Sister Match, but it's a little bit word of mouth. Mm-hmm. And I attend a support group. There's a great support group in Long Beach, and I attend, and I love going because those ladies are all so nice. And Suzette, who runs that support group, is amazing. Always has fun stuff for us to do. What else have I done what else do I do? I don't know.
Advocacy, which it's a different type of advocacy, right? But you joined us for the summit for Advocacy Day, and you've also been a part of that. So
yeah, I'm out there advocating for the patient voice, and I think sharing stories saves lives. So I'm all for whatever pops my way.
Thank you for that, Robin. So as you know, you've gone through the training. We've talked a little bit about what motivated you to apply and what you're doing now. How would you say personally the training and joining the program has affected you? And have you had a chance to interact with a person who maybe was in need of some type of resource that you were able to refer them to because you're a Women Heart Champion, because you've gone through this training, or because of something you learned? Sort of a long question there, but anything about the impact it's had on you or on others?
For me, the impact, I think the greatest impact is the sense of I belong somewhere with this heart disease. And I was given the second chance at life, and to find the community that really gets it when I walk into a room, it's this feeling that I'll never forget that first time I walked into the room when we were doing the Capitol Hill training, and to walk into a room of women that all understand what my journey has been like, or at least can relate to living with it, because there's a lot of highs and lows and there's a lot of just uncertainty, and to know that you're surrounded by all these people. And I've got great friends and a fabulous family, but until you really have, laid on the table and walked those shoes, it's really hard. And so to me, the greatest impact is the sense of sisterhood and community and support. What was the second part?
If you have any story of like using what you've learned to.
Oh my gosh. I'll just do a quick story. We did a presentation to a local sorority chapter at one of our local universities. And one of the things that really surprised me through learning with the knowledge that WomenHeart provides us is the risk of heart disease during maternal health and during your quote childbearing years. And so it was so amazing to take the WomenHeart resources into this group of college age women. And we not only could talk about making sure they understand potentially what their parents were going through as they were going through the aging process, and to share the materials with their parents in terms of knowing your symptoms, but it was start the discussion with your family about the medical history, right? And so to be able to engage these college age women at a younger age to really start to take control of their own health, it empowered them. And, the red bag of courage is such a spectacular gift that you guys give us as champions. So thank you. And that to me was super meaningful, because we're meeting them where they are, right? In their sorority house chapter meeting. And we're meeting them at a younger age. And so hopefully we're improving their quality of life over their lifetime. And we're touching on family history and helping their parents as they also navigate the changing of the body as we age. So
it's amazing. Yeah, you're sharing so much, right, with people who may not have come across this information otherwise. And
they wouldn't think about it. What 20-year-old's going to think about my maternal health and heart disease, right?
And we don't talk about it enough. So
excuse me.
Absolutely not. Barb?
Well, I actually had two experiences before I became a champion that really helped spark my interest in being a champion. One was in the middle of COVID. There was a local woman, but this is the kind of thing you would do in WomenHeart. There was a local woman. She actually went to my hairdresser, and she was telling her a story about her heart, and my hairdresser says, "Oh, I think I know somebody with the same condition." And she had the same experience in our little town of being blown off and not diagnosed properly for HCM. So we got together and I changed her life. We were talking and it was like, "Hey, why don't you go see my doctor at Cleveland Clinic?" And she did. She got a septal myectomy and is in perfect shape now, but it was like it was really a true story of networking. And another woman is Mayo Clinic has this wonderful patient log site where you can get on and communicate with other patients. And Have you seen that with I think it's called patient, I don't know, it's their communication thing. And I saw a woman from Oregon, Western Oregon, who was talking about being, I was diagnosed with heart failure with preserved ejection fraction. I don't even know what that is. And they don't know what to do with me. And I have that. So we've been communicating. And what I discovered is she was not properly diagnosed. You need a right heart cath to be diagnosed for that. And she ended up going to Cleveland Clinic and found out she did not have that. And it was just an interesting perspective of networking with people, and both these people were from a rural community. So, but I'm learning to navigate, how I'm going to impact people and everything. But those two experiences were very impactful. I also met a woman when I was doing cardiac rehab at our local hospital, a young woman who had broken heart syndrome. I'd never heard about that. She'd gone through a divorce, was really stressed out, and she had a heart attack with no blockages. So we started having lunch together once a month. And what that did was help her to have an older person who understood and just could listen, and those three experiences just showed me how I could make an impact with WomenHeart. And so I'm really pleased right now to explore this journey, how I can, in a more organized, informative way, to impact people, especially in a rural community.
Yeah. It's amazing how throughout this conversation, you both highlighted sort of like the spectrum of the things you could do, right? We've gone from serving on panels, right? Advising on like research and the different things that are coming out for patients, to doing presentations in the community, talking to sorority, right? Talking to groups, to that more of like the networking that happens and you end up providing one-on-one support. I know in my work with champions, many of them will say like, oh, they know me really well in the community. So like if a woman gets diagnosed, I might get a call that says like, oh, hey, someone gave me your number, or can you offer support? And so that is very much the experience of many champions. And I love that you all are highlighting it just in this conversation between the three of us. And I'm sure there's more. I'm sure there's more things I'm not necessarily thinking of right now, but there's many, many ways in which champions engaged. So as we get closer to the end, I want your help sort of speaking to the women who maybe are considering this or like, oh, what is this? I'm not so sure. I think there might be occasions in which people, they're interested, but they feel like, oh, I'm not qualified to do this. I can't do this right now, or I don't have the skills. What would you say to those women who are maybe thinking about it, considering it, but just are afraid that they're not prepared or they're missing something?
Well, I would say go through the training. It seems like for somebody like that, maybe going through the virtual training first because it's easier, then you can always do the in-person. But don't go above your skill level. There's a place for everybody in this. Yes. And, I do not feel skilled enough to run a support group. Maybe in 3 years when I have more experience, but I think you need to be realistic about where you're at, where your skills are, and start from there. That's why I want to start with one-on-one, not make it real super time consuming, not push it, but just try and find interested people, and I think keeping your perspective where you're comfortable is just so important. Don't go out of your comfort zone right yet. You might later, but just move slowly.
I agree. I think that is excellent advice. I would add, there's room for everybody in this program, and you don't have to, if you're not comfortable speaking in public, it's okay. If you don't want to run a support group right now, it's okay. I mean, there's ways to be involved in policy, that you can help write letters to Congress, and you don't have to do public speaking if you're afraid of that. If you think that being a WomenHeart champion, you're always out in the public and you're always out speaking. No, it could be as simple as just talking to people in line at the market and, going back to your cardiac rehab and doing a lot of one-on-one. It could be as simple as hosting joining a table at one of the local health fairs or walks in your community. I know a woman who started a walking group, and she just likes to walk, and she didn't want to walk alone, and all of a sudden it's become this thing. And so they just walk twice a week, and she has no interest in public speaking. She has no interest in going to public events. She just wants to help spread the word in her way. And so I think there's a place for everyone. I really, really do. And I think that WomenHeart embraces that. It's not a competition on who's doing more or what. It truly is not. It's educating the public is our key number one. And however we do that is right.
Mhm.
Thank you so much for that, Robin. You're absolutely right. There's room for everyone, and there's a lot to do all over the country with different groups in different ways. So there's always room for everyone here. All right, as we close, I am going to ask for one sentence what would you say to a woman to encourage her to become a WomenHeart champion?
Give it a go.
I love that.
Give it a go.
Let's do it.
Let's see, impact other women's lives in a positive way and give them the strength to deal with their heart issues.
Believe in yourself. You can do this.
Yes. Yep.
I love that. Thank you so much. Thank you both for joining me today, for sharing more about your experience and what motivated you and sort of what you've been up to now and where you're hoping to go and continue to serve as a WomenHeart champion. So I really appreciate you both being here with me today for this conversation. To those watching our live, if you are considering becoming a WomenHeart champion, if you're interested in the program, I really encourage you to try it out. Like I mentioned, there's an application process. You submit your application and then you're invited to an interview, which I also like to highlight for people. That is a great opportunity to learn more. So
Yes.
That is an opportunity to chat with me, Sarah, some of my colleagues who can share a little bit more about, how things are done, what you can expect from the training. So even if you're sort of curious, it's still, I think, a good chance to give it a go and really just put it out there and learn more about the program. I also want to highlight that while we are recruiting for our in-person symposium for this fall, we will have, as soon as that closes, we'll also have an interest form open for anyone who might be interested in the virtual symposium as well, because that is something else that will be happening soon. Again, the trainings happen twice a year. So just to encourage you all to join us for the symposium. It's an opportunity to learn more from, the clinical experts, also hear more about storytelling, get to practice your storytelling skills, and then being in a room or a virtual room with a lot of other women who have similar experiences and hearing from them and then learning from there how you can best impact your community and the other women who need that support. So just saying, putting it out there, it's still open. But again, thank you all for joining us, and thank you to both of you, Barb and Robin, for joining us for this conversation. And I hope to see more applications come through and more women who might be interested in joining the program so we can share more about it. All right.
Thank you.
Thank you all.